Can I just say, like, really quick, when I logged onto TikTok, open TikTok, whatever, this morning, and saw all those notifications, I panicked for a hot second. I thought for sure my ex was up to his bullcrap again, and I had to take a solid 10 minutes to cry when I realized that was not the case, and it was someone just, like, genuinely interacting with me. So I am so hyped to answer these questions. So first question was, what was the process of getting HRT like for you? Did you need a dysphoria diagnosis? Was there a long waiting list? And did you have to get a lot of testing? And it says bloodworm. I know you mean blood work. It's fine. So what was the process of getting HRT like for me? It was easy, and I say that lightly because initially I went through my family doctor, who was like, I cannot do this diagnosis. I have to send you to a, I don't want to try and say the title because I'm going to get it wrong. It was like a urologist, something like that. Don't laugh at me. So she had to send in a referral for that. And then I waited 2 weeks, and then I called them and I was like, hey, I'd like to, schedule an appointment, with who I was working for that. Basically there's only two, we'll call them specialists so I don't embarrass myself trying to say the title again, specialists who do my diagnoses, which was transsexualism. Their waiting list was insanely long. Like, one I could not get into until May. The other one I could not get into until March. So I had a whole breakdown about that. I did schedule to go see them in March. Whether I do that or not, I'm not sure. But I ended up, after having my breakdown, reaching out to one of my friends who is also transsexual. I was like, so where did you go to get your hormones? And they went to, and I'm hoping this does not get my video like blacklisted, but they went to the PP hood, the planning parents hood. So that's where I ended up going. And that honestly was super easy. I ended up making an appointment and seeing them within the same week. Going through them, I did not need a dysphoria diagnosis. Like, that was not basically, which I'll get into with the other questions, is we just sat for like an hour on video discussing like my history and what my goals were. So was there a long waiting list? Yes, for the specialist. But for the route I ended up taking, no. It was days. I literally got in the same week. It was fantastic. Did I need a lot of testing and blood work? I can't speak for the specialist. I might, if I go to the specialist, have to require testing. For the route I went, all I had to do was have a recent blood pressure reading that was normal, and then I had to get blood work done where they test your red blood cell count and your cholesterol, I believe, because those are two things that can be affected by taking tea. Next question is, did they ask you a lot of questions before getting HRT? Is it important how you identify it, or do you just tell them what you're looking for and they give it to you? Again, I cannot speak for a specialist, but for the route I went, they did ask like a lot of questions as far as gathering for health questions, and like how I identified, what pronouns I wanted to use, how long have I identified like that, and like what my goals were. Like, we discussed whether I want top surgery, or I want bottom surgery. Did I want to do gender dysphoria therapy? Did I want to do voice training? Did I want to do egg preservation? All of that. So there was a lot of questions going into it, but it wasn't like they were questions where I felt like I could answer them wrong and then end up not getting the hormones. Like, they just wanted to know so that they could help me and guide me in the right direction. So the follow-up to question 2 is, if so, does that mean a cis woman who wants a deeper voice can go in and be described T? I don't want to say, like, yes, for sure, because I don't know. But, like, honestly, like, I've seen personally, like, in YouTube and TikTok where I watch, where people, like, do exactly that. Like, men who want to be more feminine get on estrogen, and women who want a deeper voice or other pros of taking testosterone go and get on that. I actually, in a previous relationship, one of his sister's significant others got on testosterone. They did not identify as wanting to be identified as male. They were non-binary. They just wanted to present more masculine. So they got on T. They had no intentions of, like, going through the full transition. So, like, I want to say yes, like, especially through where I went with the PP hood. They were fantastic. And I think if, like, someone just wanted to get on testosterone to benefit from some of those benefits, that it wouldn't be a problem and they would be able to help you with that. Did they give you a whole year's supply of HRT or just enough to last a month? Also, do you have to refrigerate it? No, you do not refrigerate testosterone. Actually, if you refrigerate testosterone, it will destroy it. It makes it crystallize, and then you can't use it. Did they give me a whole year's supplies or just enough to last a month? They gave me, the way they prescribed it, they gave me just enough to last until my follow-up appointment, which is in January, where they're gonna review my blood work and everything, and then decide whether I stay on this dosage or go up. Technically, if you don't follow the prescription, because the way prescription is written is you're only supposed to take one shot out of a vial and then throw that vial away. Obviously, that's a huge waste. And if you're sanitary about it and doing what you need to do, you can definitely take more than one shot out of the vial. So technically, I have more than the 3 months worth that they prescribed. But by technicalities, they prescribed me 3 months to get to my next appointment. Did you get to decide which form of testosterone that you take? Is there a reason why you chose injection instead of a gel, or was that the doctor's choice? You do get to decide through who I went through the PP. She presented all the choices, and I was like, I would really like to do the injection. And she was like, really? And I'm like, absolutely. I'm told the gel works just as well. I just wanted to do the injection. I don't know why. Maybe because I'm afraid the gel is going to be a sensory issue. But you do get to decide. I also did get to decide the type of shot that I had. It was not you have to do the intramuscle or the fat. I got to decide, and basically I could even go back to my next appointment and be like, hey, I'd like to try the fat one now, and they would change the prescription for me. This video is already at like 10 minutes, so I'm going to end up having to do the other 5 questions in another video. So question 5, what does the burning feel like after you take tea? Is it like icy hot or Bengay, or is it just really warm like you've been working out or something? It is 100% like icy hot or Bengay. Like, now as you said it, like, yes, that is exactly what it is. It just feels like that, like when the icy hot or Bengay initially, that like cool heat, but it doesn't last. It's just initial, like enough to make you go, ooh, and then it's done. That's it. So after this video, I'm going to answer the other 5 questions in another video, so keep an eye out for that. I am sorry this is so long.